Hello everyone, this is Marshall Riddle, and I'd like to welcome you to our webinar event today, the Post-Election Healthcare Agenda, Analysis and Implications for 2013 and Beyond. Our speakers today are Mark Lutz, member of the firm Epstein, Becker & Green, and William Oldecker, member, National Health Advisors. Before we begin, a few housekeeping items. If for any reason you experience technical difficulties with the web portion of today's presentation, please print off the PDF of the presentation that was included with your dial-in instructions. This link is www.healthwebsummit.com/election111312.pdf. As always, if you require any other assistance, please contact the Health Web Summit office at area code 209-577-4888. We will be taking your questions today using the live chat feature. Please use the chat box to enter your question. We're now ready for our event to begin.
Thank you, Marshall. It's Mark Lutz. Good afternoon. Welcome, everyone, to today's discussion of the healthcare agenda post-election. Again, I'm Mark Lutz, and my colleague Bill Oldecker and I welcome the opportunity to speak with you about the shape of the legislative and regulatory agenda during the next 2 months, as well as the first 6 months or more of the incoming Congress. We work together along with a diverse team of advocates and analysts in a public advocacy consultancy, National Health Advisors, here in Washington. Bill brings to today's discussion many decades of work on healthcare issues in Congress, and I'll leaven the discussion with my perspective of almost 3 decades as a health regulatory lawyer. Our agenda today has us first reviewing the impact of the election on the administration, the Congress, and the state houses. Second, we take up the shape of the fight over the fiscal cliff during the remainder of this Congress, its so-called lame duck period. Third, we'll examine the potential structure for the debt reduction work to be done into the next Congress, followed by a discussion of the places that Congress is expected to look for savings in federal health care expenditures. We'll then speak about implementation issues on deck with or without legislation and try to leave you with a few parting thoughts. Bill, since we went to print on this slide a couple of days ago, the Electoral College result has become much better known. And certainly on Election Day, we learned who the leader of the executive branch was going to be for the next 4 years. But what does that tell us about the kind of leadership that will be coming from Pennsylvania Avenue during the debate over averting the fiscal cliff and during budget negotiations? And also, if you will, what do you expect in terms of change at HHS or CMS that might be relevant to our listeners?
First, although President Obama was reelected with 332 electoral votes, I don't think that President Obama will mistake this and say that he has an absolute mandate to do exactly what he wants. If you remember, George W. Bush had a somewhat smaller, but he won by over 50% also, and claimed a mandate. My bet is that President Obama is going to be in a mood to negotiate and to try and get some bipartisan support. Second, as far as CMS and HHS, there's always turnover, and I would expect to be turnover at the top there. It has not been rumored yet one way or the other whether the Secretary of HHS stays, but I would suspect that she probably does stay for a while. There's a lot of implementation that has to be done in the very near term. I would think that they still have to find a permanent head of CMS, and so there's going to be changes there.
Great. So let's think about the new Congress. A few changes there, and what do you think that means for the future of the ACA? What does it mean as in terms of the sources of leadership and the avenues for deal making as to the entitlement programs and as to ACA issues as they're examined in the crucible of federal deficit reduction?
I think that the one big outcome that is unassailable in this election is that the Obamacare, the ACA, the Affordable Care Act is now going to be permanent. And the regulations will be implemented. There'll be a flurry of regulations coming out in the near future. The exchanges will be implemented to the extent that states want to implement them. And I think that you're going to see, this Congress is only slightly more democratic than the last Congress, but I think members of Congress read the election results too and realize that they're going to need to improve their approval ratings. So I think there'll be a move for compromise on the Republican side also in the House and Senate.
Finally, there was some change in the state houses and the state legislatures. With your health care hat on, how would you evaluate them?
I think that they're essentially neutral. One governor changed hands. North Carolina became a Republican governor from a Democratic governor. Most of the state legislative changes were increases for Democrats. From California, which has two-thirds of both of its state houses are now Democrats, to places like Maine, whose both houses went from Republican to Democrat. In New Hampshire, the state representative house went from Republican to Democrat. That is the most usual change, or it narrowed. So the likelihood of the implementation of exchanges is greater. Still questions remain in some states over whether or not they'll take Medicaid and whether or not they will actually themselves do the exchange, but the federal government is the backstop if they don't.
Our next slide, I would call this more of an outlook slide, Bill. Over the last year or so, it was probably generally thought that the ACA had two big hurdles, the Supreme Court review and the presidential election. And after that, it would be smooth sailing, a land of milk and honey for health reform. Probably comes as a rude shock to health reform partisans that certain portions of the ACA may not be out of the woods yet. There might not be a legislative majority for repeal, but issues could still arise because the key elements of the ACA's access reforms could be tempting targets during deficit reduction making. So as we think again about that, my guess is that this presents more of a rocky road or a lunar landscape. I think there are plenty of craters left for health reform to navigate.
I think beyond just the health reform, I think that health is such a substantial portion of the federal budget that it will be under attack, and no matter what happens here in the near future.
Well, as our listeners have no doubt been reading, the issue commanding Congress's attention for the remainder of the session is the so-called fiscal cliff, comprised of expiring tax cuts and the 2% cuts via sequestration that are slated to take effect next year, given Congress's failure to address the deficit through the activities last year of this past year of the Super Committee. Now, in this slide, we've got a starting gun, or at least some runners on their mark. If I remember correctly, a couple of days ago, in fact, it was probably the day after the election, Speaker Boehner fired the starting gun, or he got a good jump off the blocks proclaiming that he was ready to work with the president to avoid the fiscal cliff, but that, quote, real changes to the structure of entitlement programs, close quote, need to be a part of the solution, along with spending cuts and revenue increases from tax reform. So the race is about to take place. Bill, is that a fair statement?
Yeah, there will be two parts to this race. The first part will be from now until the end of the year. The president has said that he will not allow sequestration to go into effect. The Republicans don't want the $1.2 trillion, which is half domestic and half defense, to go into effect. And so there will be negotiations to figure out how that is done. The president also wants to see the upper income taxpayers pay more, and the push tax breaks expire at the end of the year. I think negotiations will start later this week with the House congressional leaders, the Senate congressional leaders, and the president on how to go about doing this. Any delay of the sequestration, among other things that could be delayed, have a fairly significant cost, so they're going to have to figure out how to pay for that.
Right. The president to date has been a little less loquacious on the subject, but he is setting the stage for negotiations and bipartisan conversations scheduled for the White House beginning this Friday, as you said. I think the initial signals have been to the effect of, I'm open to compromise, quote, I'm open to new ideas, but that approach has to be balanced, meaning it needs to include revenue. How do you interpret those framing remarks?
I think that the discussion will go in two parts. One will deal with sequestration. The other will deal with revenue. The president realizing that if he can't get agreement on revenue, the tax cuts expire and will bring revenue, and then it will be an issue of how do you throttle them back in the new year. But the sequestration, there has to be an agreement among the parties about how you put that off.
So that initial sparring aside, how does it look? How does it look for the country, peering as this slide shows us, peering over the so-called fiscal cliff? Will Congress act to avoid that, or will it, at least in some respects, allow the expiration of tax cuts and sequestration to take effect?
I think at the end of the day, they will act in a way that will not allow sequestration to go in, and they'll actually have a deal on tax cuts, the expiring Bush tax cuts and where they come out on that. But that's only part of the problem. The other part of the problem is they have to get a budget agreement to lower the deficit.
So, Bill, on this slide, we try to review some of the basic things that are on the table right now, some of the things that are dealt with. Is it likely that we can get all of these things dealt with in the next couple of months, or might there be some other technique employed?
I think that it's almost impossible that all of these can be dealt with by the end of the year. There are a number of them that they seem that they have to deal with. They have to deal with sequestration, and they have to deal with the Superstorm Sandy. They have to appropriate money. They have another item that's not on here. The alternative minimum tax has to be dealt with, or at least I'm being told that they believe it's necessary to be dealt with. The others could be put off for a later negotiation, but they will have to figure out a way, if they're putting off sequestration and deficit reduction, a way that if they can't agree, that they can enforce it.
Thanks. And, as I listen to you, it seems to me that there are makings of an interim compromise during the so-called lame duck session, because House Republicans ultimately need a bill to avoid the defense cuts that are lined up in case sequestration does take effect. And the Dems would like some kind of deal as well, because they wish to avoid the sequester's domestic spending cuts, and they want to bring some upper income revenue to the party. Bill, though, for today's listeners, to me the $99 questions are probably two or three. What's the chance that the lame duck deal will involve ACA funds, e.g. the funds that otherwise slated for Medicaid expansion, or the funds slated for exchange enrollee subsidies?
I think they're down at the bottom of the list that the administration would agree to. They will be on the list that the Republicans put forward, but I think that the president will try to protect those as much as possible, both the exchanges and the Medicaid. Without the Medicaid expansion, you really don't have a whole piece of cloth, and people will be falling through that, and they will not get coverage, and it will hurt hospitals who are expecting that money and others. So it is, I think those probably will not be where they go. Right now there's a 2% across the board cut on Medicare, I think mostly affecting hospitals since they're the biggest. But, I think that there will be some compromise that will be more universal than actual specifics on Medicare.
So would you think that the normal market basket type issues would come up in the lame duck session? What would the candidate pay-fors be? Can any of the industry sectors afford to be asleep during these next couple of months?
I think any sector in the healthcare industry that has been scored and discussed in the past as a savings will be on the table. There'll be different people with different interests pushing different ideas. So there are lists that staffers have on the Hill that have all of those scored items. So anyone who's been in the area where your part of the industry has been scored is at risk because they can put those into an agreement fairly rapidly. They already have a CBO score.
Got it. So from a overall perspective in the next couple of months, am I positing correctly that we're looking for Congress to kick the can a number of other months ahead so that it has time to do a larger deficit reduction deal?
Yes, I think that the outlook right now is that they will get an agreement to deal with sequestration and several other tax items that have to be done, and that they will put other things off to a later date. If you look at SGR, my bet to fix that, it costs about $300 billion over 10 years. They're going to have to put that off until there are bigger talks that deal with rewrite of the entire tax code and a new budget deal. So, so my bet is that SGR will not be done by the end of the year. It'll be in the bigger deal. I don't know whether that deal is going to take us through the end of March or whether it will be 6 months into the new year before they put a backstop on it.
So in this next slide, we have our parachutes, and we have our little birdie remarking that in a cut environment, there are some interests, even healthcare interests, will fare better than others. I noted that we chose to, just picking up in your SGR point, have that be a save, if you will, or a soft landing, perhaps a little bit further down, down the line. And likewise, the saving of the middle class tax cuts might be a second tier save. Can you explain that a little?
Yeah, I think the middle class tax cuts will be saved. Now, whether they're saved by the end of the year or they're put back in after the end of the year, I would bet a lot of money that ultimately the middle class tax situation does not change. SGR ultimately will be taken care of. Now, whether they have to make cuts over the long run, I don't know, but they have fixed SGR a number of times retroactively after it went into effect. So my expectation is that they will fix it retroactively whenever they get to a budget deal.
Interesting. Well, let's talk about what a budget deal might look like. Let's talk about what the overall framework for that deal might look like. First of all, we should talk about what the size of it is likely to be. Do Do we have any insight into the degree of deficit reduction that Congress will seek and the framework or the architecture for the deficit reduction deal that will follow?
Right now, it seems that at least in the Senate, where I talk to more people, the number of $4 trillion over 10 years seems to be firmly fixed in the minds of both Democrats and Republicans. That was the number that came out of Simpson-Bowles. They arrive at the number in very different ways, though.
And there's also a framework for getting there, right? A framework, at least, that the president has alluded to. And if you push back on Simpson-Bowles and look at it overall, there's an overall architecture to Simpson-Bowles as between spending cuts and new revenue. What's the formula for the New Deal that we've depicted in this slide?
The New Deal that the administration works from is $1 of revenue enhancements, or that means increased revenue for every $3 in cuts in expenditures, projected expenditures over the next 10 years.
Well, healthcare is going to be a healthy portion of that, so we'll get into that in a moment. There's one other concept that I think our listeners should have in the back of their mind, because it certainly proved to be an important part of the last budget negotiations, the so-called backstop concept. Recall that the super committee's work last time was backstopped by the sequester that we're facing now. Bill, I understand that Simpson-Bowles is frequently mentioned as a candidate backstop for this deficit-cutting exercise. Who likes Simpson-Bowles for this purpose, and why do they like it?
Curiously, in talking to people on the Hill, in the Senate side, the Senate Republicans now have taken up the Simpson-Bowles cause. And I can't give you the exact reasons for that. A number of the members of what they call the Gang of Eight, which is 4 Democrats and 4 Republicans, use it as kind of base architecture to talk about what they'll do. And I think it's merely because it's there. It was actually had 3 Republican senators who were on the Simpson-Bowles commission voted for it. So it starts off with several conservative adherents on the Republican side, Larry Crapo being one of them in the Senate. So it is talked about as kind of, if we can't agree, this is what we would like to see. That doesn't mean that there aren't other candidates for this. I think that there are.
What other candidates would you think about as for backstops?
They could. I mean, the ugliest one they could come up with is the exact sequestration like they have now,
right.
And everyone hates that. Both sides hate that, but that is something that they could do. They could come up with some other methodology that is kind of rough justice. I think the problem is they know that there is a chance they're going to fail, as they did with the super committee. So my guess is they're going to do something more finely tuned. It may not be Simpson-Bowles. It may be an amalgam of other things out there. There's also the Domenici-Rivlin panel that came up with numbers also.
Right. Now, Simpson-Bowles, to our knowledge, has it made it into legislative language yet? So it would be a task, a heavy lift for the lame duck to get through a Simpson-Bowles.
It has never been scored by the CBO.
Okay.
And whether there's legislative language or not, it would be difficult, as we know, to put together a bill of this size in a short period of time. It would affect every part of the government, so it would make the ACA look like a small bill.
Well, it's probably worth spending a slide or two, though, thinking back to some of the healthcare components of Simpson-Bowles, either because it is a candidate backstop for the kick-the-can deal that is being talked about, and because when we get to the overall deficit reduction deal, it will be one of those lists that you described from which Senate Finance and other committees look to pull ideas from to get the deficit reduction deal funded?
There is no doubt that the Republicans will not sign on to any deal that doesn't have basically entitlement cuts in it. And entitlements are made up by Social Security and Medicare and Medicaid chiefly. And since I do not believe that the president will negotiate on Social Security at this time, we'll put it off to a different time. And as I said earlier, Medicaid has become an important component to making sure that there's access for everyone to health care. I think most of the weight will fall on Medicare in the debate to give the Republicans a win on entitlement cuts. And I'm sure there are different views out there, but I think that Medicare is at substantial risk. Medicare grows between 2011 and 2022 from $556 billion to $1.044 trillion in that 10 years. So it is one of the faster growing programs in the budget.
Okay. It is certainly interesting to look at the Simpson-Bowles list relative to some other lists and realize how, as you've indicated, it does include notions that go to entitlements. They're not just the usual market basket type changes, but start to ask some fundamental questions about structure entitlement programs as well as the federal state balance. And as I think about from a managed care perspective, including the provider-sponsored managed care sector, some of these questions or some of these elements around potentially mandatory dual eligibles in managed care, one can envision that as fertile territory for emerging alternative delivery systems to weigh in on and to be speaking with the Hill about if they seek to play expanded roles in the healthcare system going forward. You know, the ACO movement could have a counterpart in the rethinking of the handling of high cost Medicare cases and the rethinking of care patterns for dual eligibles. We're probably up to 25 states now planning dual demonstrations with duals, some using payments to health homes intended to reduce readmits and ER visits, others using a more capitated financial approach. And so therefore it's pretty interesting to see that moving alongside of continued thinking in the Simpson-Bowles context around the treatment of dual eligibles in the system.
I think you're absolutely right. There are going to be experiments that have proved helpful in reducing costs. I think this is in Medicaid and the dual eligibles for Medicare and trying to combine them has been productive at CMS. They're going to look how they can do more of that. And I think that Democrats probably can work out a compromise with Republicans. Democrats also will try, as they have in the past, to cut Medicare Advantage. I don't know if they'll be successful, but they will certainly put that on the table. If you really look at some of the issues here, you really don't have to go much farther than to look what the biggest expenditures are for in Medicare to know where some of the biggest risks are. Hospitals go from about $166 billion to almost $300 billion between 2011 and 2022. Hospitals are going to be in the crosshairs of people looking at where they can cut.
Yeah, that's funny. So I think it's a great segue into the pay-fors part of this discussion. Jesse James was famous, I think, famously attributed to saying, "I rob banks because that's where the money is." In healthcare, I think, Bill, what you're suggesting is that there are a couple of categories here which are always discussed simply because there are large federal expenditures involved in those, whether they be hospitals or physician pay schedules or Medicare Advantage program. We're always back asking the questions, is there a different way that payments should run, and is there any availability for economizing in Medicare and Medicaid payments to these sectors?
And I think there'll be arguments on each one. Hospitals will have to defend themselves actively. Doctors are going to be put under, especially specialty doctors, are going to be put under the microscope to see where cuts can come. Medicare Advantage is starting to prove effective since they've been cut down to 100% of fee-for-service. But I think, and Medicare Advantage keeps growing, there may be more savings that can be found there. Post-acute care, of course, is something that CMS has worked on very hard. And pharma, I think, is itself at very great risk. They cut a pretty good deal in the ACA itself, but the government still cannot negotiate pharmaceutical costs. So I think that will definitely be something that Democrats push for. I think, there's some subtler things that will go on, beyond, and I think probably something that both Republicans and Democrats will agree upon, as you said, is placing dual eligibles in Medicare managed care. I think is something that both sides will agree upon. But I think that there will be talk by the Republicans, and President Obama has seemed to agree, at least in trying something on malpractice reforms. So there'll be a number of issues that are going to come up. The other thing is they're going to try and limit the state gaming, or what's viewed by state gaming, on Medicaid itself.
And the intergovernmental transfer.
Intergovernmental transfer.
Right. Okay. Well, is there an overall tendency that we could characterize here as the two ideologies battle each other over where the cuts should be made in order to fund this deficit reduction package? Is there a way to think about where the administration may be coming from versus where Republicans particularly House Republicans might be coming from is?
I think the overarching desire of House Republicans is to cut the rate of growth of Medicare spending. And, they're going to view that as a victory if they can do it in a way. The Democrats' their counter chess move is going to be offering cuts that probably are less appealing to the Republicans. One of those things would be to restrict first dollar Medigap coverage, which has been a scored item and scores as savings. That is one of the few places where the Democrats would agree to actually cut or affect beneficiaries. And we'll see how that, will go. But they're on the list. They have, a number of things. The Democrats and Republicans will agree on anti-fraud. Whether that's real or unreal is a little hard to say, but they will get a scoreable number and come up with a methodology to deal with that. But then, will they have the ability to reduce medical education payments? Democrats will probably resist that, but there are things like that which will be on the list.
Interesting. So the tug of war is indeed an apt depiction of what we'll be watching over the months ahead. I think you said something very wise early on, and that was that any organization or any sector that has had cost savings scored relative to its participation in the market needs to be vigilant, both in the lame duck session and during the overall budget negotiations. Perhaps it makes some sense to review with our listeners a bit how the Congressional Budget Office has ranked the available savings from some of the larger categories that are talked about. In this slide, we've shown how CBO has rated the deficit reduction potential for a whole variety of program changes. How do you think about that, and do you have any view among that couple of $1 trillion that we're looking to Congress to achieve in savings? Do we have any feel for how much healthcare collectively will need to contribute in terms of cuts?
It's a kind of a moving target. I would think, though, there will be cuts. I would expect them to be above $20 billion and probably above $30 billion a year. They could run as high as $50 billion over 10 years, maybe even somewhat higher. It is, when you think the expected 10-year number for Medicare, again, to be $1,044 million, it's a big target when you look at it on an annualized basis that of that amount in the end year. So I think the effort is going to be to cut the out years, first to figure out how you cut the out years of Medicare spending, and then work back and then come up with the numbers that will accomplish it.
So it can be both actual cuts and
rate of growth
delays.
Cuts. Rate of growth cuts.
Got it.
But there will be some actual 2013 cuts.
Right. Okay. And then, so looking at the ones that you've just talked about as being some of the most frequently talked about and where consensus seems to have already emerged, medical malpractice, so perhaps some things around GME. Those numbers in and of themselves are only in the, at least according to CBO, the $10 billion range. So it would conceivably need to add cuts in a number of other areas to approach the type of deficit reduction that seems to be necessary here.
Correct. I mean, if you take some arcane things like extending Medicaid drug rebate to dual eligibles, you actually create a savings of 10 years of $49 billion. Now, what you're looking to do is figure out how you can add up these savings to come to, 200 or 500 billion. So they're going to be looking for fairly big number savings each time they do it.
Interesting. Well, what is probably on many folks' mind, particularly after a heavy political campaign has been waged around the preservation of healthcare reform through the ACA, or its possible, overturning, and as we said earlier, at least it doesn't look like it's going to be overtly repealed. But how likely is it that some of the big-ticket expenditures called for in the ACA, particularly those involved in subsidizing enrollment, individual coverage enrollment on the exchanges through exchange-mediated products, or the federal costs to be assumed in expanding the reach of the Medicaid program to additional persons. Would it be fair to hypothesize that those would be two buckets of gold that House Republicans would like to tap into to help meet this budget gap? And if that's a fair hypothesis, how do you think the debate goes there?
Well, exchange coverage is going to be an interesting debate because a number of states are not actually going to use their exchange money, either because they have decided not to and don't wish to have a local exchange, or because they're going to be too late to come in and apply for it. I think there is savings, therefore, if the federal government is establishing a thinner, more svelte exchange for these states, at least temporarily. The federal government is going to basically do something that's pretty universal as far as the exchanges, and will be less costly to implement. So there is some money probably that can be taken out on that basis. For the states that are already doing their exchanges, I think that there may be some money that can be arguably cut from administrative costs there. So there will be a push and pull on exchange subsidies. The administration is going to want to see that the exchanges go forward and they won't delay them by a year. That will be an argument that will be put forward.
There would be an argument for delay of a year as a savings opportunity,
and it is a savings,
and more as and perhaps even also as from an efficacy or an excellence of the vehicle perspective.
That argument will go on. My bet is the administration doesn't give on that, but there are pretty good arguments that because of the lack of clarity as to whether the president was going to get reelected or the Supreme Court was going to uphold the act, that there's been, in some states, a slowness to act.
Mm-hmm. And what about the argument that is out there? I think there's at least one case on the subject right now as to whether or not the ACA authorizes subsidies for exchange enrollment that occurs other than through a state-run exchange. Would a budget negotiation be an opportunity to address that, perhaps in the architecture of an overall compromise around the timing of the exchanges?
It will be discussed. There's no doubt about that. I think that will be discussed. I think it's much easier for the administration to give money on exchanges than it is to give money from the other pot, the Medicaid pot.
Okay, and why is that?
Because the Medicaid pot is for the poorest Americans, and it grants them coverage under the ACA, and in all likelihood, they would remain unable to pay for coverage if they cut back on Medicaid and many of the other things in the Act, which then start to be affected. Hospitals would be getting much larger unpaid or uncompensated. They have to use a lot more uncompensated care, which hospitals basically are looking forward, believing that they can take some of the hits that they have gotten because they're going to have more compensated care.
Right. So alongside of those legislative deliberations around the budget and deficit reduction, there are a number of things that are going to be happening from an implementation perspective. The exchanges are indeed one of those things, and there's been a lot of activity in recent days around the timing of the exchanges. As you probably know, there are three options: a state operation under overall federal parameters, state and federal partnerships being another option, and the federal fallback operation being a third option. The states are supposed to tell the Department of Health and Human Services if they'll implement the exchanges by themselves by this Friday, the 16th.
Correct.
It's pretty quick. However, HHS has told the states that as long as they indicate they'll follow a state implementation pathway, their blueprint for how that's going to get done they have up to another month to submit that. So they're trying to show a little flexibility there. If the state is going to step to the plate for some functions and then let the feds perform other functions, that due date, that decision date, is now February 15th. But it's coming quickly, and the October enrollment date for exchange enrollees is coming as quickly. Again, do you see, with that crush of deadlines, do you see delay being feasible as a feasible way to gain savings and maybe to clean up the ambiguity around the support or subsidy?
I think there may be savings that CBO will score as a number of states give up their ability to have their own exchange. That doesn't mean they can't have them in the future, but at least temporarily. And because I would think it's never been scored as to having how exactly the cost would be allocated if the federal government is doing it in a number of states. The other thing that will come fairly quickly, I'm not sure exactly when, but the Independent Payment Advisory Board is extant right now and waiting for people to be appointed. So they could be appointed at any time. I'm sure the president didn't want to appoint those members of that board prior to the election because of the controversial nature of that board to start with. But everything is moving along. The auditor at CMS is required to give a report to Congress in the middle of the summer. I believe it's in August. It could be in July. And then the Congress has to take that up by September 15th of 2013. And that will then be the first test of what kind of cuts of rate of growth where things are over a certain level will be impacted.
Right. And how about the other dynamic? During the election season, quite a few regulations did not appear. They were probably purposefully held back for fear that they would impact adversely in the overall public policy debate. So, for instance, the regulations on how federally funded exchanges are to be established and managed in each state, what the corresponding requirements and costs would be in the states, those hadn't seen the light of day. When they come out, which will be relatively soon, that also could change some of the decision-making at states or in state legislatures. It could, industry participants might at that point have ammunition to go to the governors or the state legislatures and legislators and say, do we really want to leave our market to this type of regulation in the hands of Washington, or couldn't we do a better job locally?
I think that's absolutely true. At first, I'm shocked that anyone would believe that the government would actually do anything political before an election, but there's little doubt that there is a backlog, and I would bet of regulations that have already been written and cleared through most of the hurdles at HHS that are just waiting to go on a publication timetable. And so I expect that there will be a number, maybe even a blizzard, of new regulations coming out now, just like the Independent Payment Advisory Board, I think, was held. I think these have been held. And I think you're right. Once people look at the advantages of having their own exchange, for one, there's a lot more control, and they can be much more diverse at the state level. So there may be pressure on the state. I expect also there'll be enormous pressure on the states where they are saying that they are opting out of Medicaid. The providers are the people who are going to be hurt in those states. The other requirements of the ACA will still apply to them, but they won't have this extra cash infusion from Medicaid. I realize the state has to supply a little bit in the out years, but in the early years, the federal government pays for 100% of it.
Right.
And so there's going to be a lot of pressure on the governor of Texas and Florida and others to reverse course and to say that they will begrudgingly accept this money.
Right. Well, your point about the impending avalanche is well taken. I looked on the OMB website this morning, and just to refresh my memory as to what might be coming down, and I noted that right the day after the election, HHS CMS had sent over to OMB the Part 2 of the exchange regulations, which also include standards related to the essential health benefits that participants on the exchange will need to offer, the health issuer and exchange responsibilities with respect to actuarial value of the policies to be offered, and standards relative to quality and accreditation, which would fall to federal interpretation to the extent that a state does not take up the option of determining what would be a qualified health plan and a qualified health plan issuer in that state. Likewise, sitting at OMB right now, ready to go, are additional rules around health insurance markets and the wellness rules that we depict on the slide here that everybody's been understood and cleared DOL, and we're ready to go. They seem to be perhaps even days away from being issued. Does that surprise you?
No.
That coincidental timing that a day after the election, these rules were ready to be sent over to OMB?
No, it doesn't surprise me. In fact, the concurrence of everything that's going to happen between now and the end of the year, I think the administration realizes that putting out all of these things, a number of them which will be controversial with groups that are adversely impacted, it's much better having a number of things out there and other things on the congressional calendar at the same time. So it's going to be very hard for people to do things legislatively to delay these, but I think you're just seeing the tip of the iceberg. I expect it will increase, and the volume between now and the end of the year and regulations that are going to be at least put out for comment are going to be enormous.
Yeah. I have a list that I've been keeping at my desk, which is 3 or 4 pages long of regulations, which are in the pipeline. Back to your point, many of them are indeed HHS regulations, but there are also a bunch that infect employers coming out of DOL, Treasury, the IRS, And all of those are worth tracking for folks on the phone. And I think as an organization, we're committed to speaking periodically through webinars, et cetera, on helping people track those and get their comments in to the extent that comment periods are open. Let's try to sum up here, Bill, and then there have been a couple of questions that have come in that we can try to address, and then get everybody back to the rest of their day. In our looking ahead slide, how do you think we should sum up the picture, both over the next 2 months in the lame duck session, and then what our listeners should be monitoring in Congress over the next 6 months or more as a larger budget deal is negotiated?
I think that the next 8 months, assuming that it takes 6 months for them to come up with a budget deal, will be the most intense area in healthcare that we've seen since, and maybe even more than during the passage of the Accountable Care Act. This is when all of it's getting implemented. And there will be two things happening at once. Will be the implementation of the Accountable Care Act, mostly happening during that period of time, so an enormous amount of paper analysis and the ability to decide how it affects you are going to happen. And secondarily, and trying to get whatever you need to do to get some modification. And then also being aware that there's going to be further changes in the overall budget, which will actually cut amounts of money that are paid out in the next 6 months, that there'll be agreement on what should be cut.
Right. Okay. Two questions that are in, and then we'll probably be up against our 4 o'clock deadline. One of the questions was, any idea when the HIPAA omnibus rule may be released?
I don't know, but I think soon.
Yeah, that as well. And I would note that I think our staff believes that the wellness incentive rules could be released as early as today. So that'll be, again, something for our listeners to be tracking, getting in there with comments to the extent there is an availability to do that. The second question we got was, won't cuts to providers increase costs to those on commercial insurance, thereby ultimately increasing health care costs? Does Congress, and I'll put a little coda on that, is that something that gets baked into Congress's thinking?
It certainly will be one of the arguments as that people are going to argue of why you don't cut providers. Now, there is no empirical evidence of that, but it's going to be whether people can get it to score at the CBO level. There's certainly a philosophical belief what you said is true.
Great. Well, that's great. I thank all our listeners for joining us today. I thank our hosts for the opportunity to share our thoughts as to the shape of things to come over the next couple of months and in the new Congress. Thanks again.
And I'd like to thank our speakers and our session's attendees for joining us today. We will be sending a follow-up feedback form immediately following the conclusion of this session, and would appreciate it if you could take a few moments to share with us your thoughts about today's session. If you haven't already done so, we encourage you to join our LinkedIn group on the web, where you can continue this discussion, post questions, and also suggest topics for future events. You can find a link to our LinkedIn group and check out a listing of upcoming webinar events on the healthwebsummit.com site. This now concludes our webinar.